Good morning. Hey, it finally is good morning. Hi, I'm Les Wagner. I'm the director of MACDDS, the County Boards Association. I see an awful lot of familiar faces, friends, people we've worked together for a long time. Thank you for coming to this celebration of the Partnership for Hope. This was quite a remarkable thing, and before the day is over, I'm sure you're going to feel very good about celebrating this tremendous initiative. In fact, one of the very best initiatives. Let me make this perfectly clear, a terrific initiative. And before the day is over, we will together once again make the Hilton Garden Inn great again. But I digress. The Partnership for Hope, we're going to talk a lot about what gave rise to it. But if you look back before that, Missouri had said we're a low-tax state and we can only serve people in crisis. And this resulted in long waiting lists when people were denied their services for an interminable period of time unless they were in terribly dire straits, because the criteria for what constituted a crisis was onerous indeed. And there were folks who said, you know, this is not right. This is not humane. It's not cost effective. And it's unresponsive to the citizenry. And it denies people the opportunity to take their place and pursue their lives and their hopes and their dreams. And so the Partnership for Hope emerged, and the rest is a wonderful tale. I want to thank the UMKC, Institute for Human Development, for their efforts in following the Partnership for Hope and interviewing many of us to assess the economic impact and benefit and the social emotional impact and benefit as well, and the cost effectiveness. We have several panels for discussion today with different emphasis, and I'm very interested in hearing from people how it has affected their professional life and how it has affected the lives of the people that they serve. Truly, it was a moment when we were able to move from a culture of no. I'm going to call you and tell you I got nothing for you, you're still on the wait list, to a culture of yes, yes, I can help you. Yes, we can help you get a job. Here today to address us from the Department of Mental Health is Dr. Mike Neitzel. Mike was appointed to the position of Department Deputy Director in December of 2015 and is a clinical psychologist with a proven record of success in leadership. He most recently served as Senior Policy Advisor to Governor Nixon in the areas of education, mental health, and social services. Prior to serving as a Senior Policy Advisor, Dr. Neitzel served as the President of Missouri State University and had a long career as Provost, Administrator, and Professor of Psychology at the University of Kentucky. He's published extensively and served on the editorial boards of numerous journals in the areas of clinical and legal psychology. As an Iowa native, Neitzel was named president of MSU March the 4th in 2005 and began his duties in July. Neitzel was named the first recipient of the Endowed Leadership Chair as of July of 2008. The chair was initially funded by current, past, and student members of the Board of Governors and awarded to Neitzel in recognition of his leadership and accomplishments. Neitzel came to Missouri State from the University of Kentucky, where he held a number of faculty and administrative positions over a 32-year period. In November of 2002, he was named provost at the University of Kentucky. Prior to being named provost, he served as acting provost for 18 months and as dean of the graduate school for 4 years. He joined the faculty of the University of Kentucky in 1973 as an assistant professor of psychology. He was promoted to associate professor in '77 and professor in 1981. From 1977 to 1990, he served as the director of clinical psychology training program at the University of Kentucky. In 1991, he was named chair of the Department of Psychology, and he completed a second term as chair in 1997. He received his BA from Wheaton College in 1969 and his master's degree in 1972, his PhD in 1973, both from the University of Illinois. He's served on the editorial boards of numerous journals in areas of clinical psychology and legal psychology, and he has been elected a fellow in both the American Psychology Association and the American Psychology Society. He served the governor well. He advised him with respect to social services, education, and mental health, and he was on watch when the idea of the Partnership for Hope first arrived at the governor's office. Join with me in thanking Dr. Neitzel.
Good morning, everybody. It occurs to me that it's kind of humbling when you have an introduction like that and most of the accomplishments occurred in the prior century. I'm here pinch hitting for Director Stringer, who's a little bit under the weather today, and so I've come to give his remarks, express his regrets for not being here, but also I know his heartfelt congratulations on the accomplishments of the partnership. So on behalf of the department and Mark, welcome to Columbia and being here to help us celebrate the first 6 years of the Partnership for Hope. I'll say a little bit personally about the partnership later in Mark's remarks, but I'm going to try to stay faithful to the comments that he has prepared. March, of course, is a great month to be having this celebration because as I know you realize, March is Developmental Disabilities Awareness Month. So this is a great time to be talking about the accomplishments of this really distinctive and successful program. 8 years ago, several people, including some of the people in this room, came together to plan how Missouri and organizations that serve individuals with developmental disabilities could maximize financial resources in order to serve the families and individuals who needed our support. Since that time, Missouri has become one of the few states that does not have a waiting list for Medicaid-funded services. The Partnership for Hope is the driving reason behind that. Back then, Missouri's wait list for services was big. It was 2,000 or more and growing. Today, that wait list is eliminated. Today, we're also marking the end of a 5-year evaluation by the Institute for Human Development at the University of Missouri, Kansas City. I want to thank those folks for hosting this event today. Their role in evaluating the impact of this program has been invaluable. So we can be here today to celebrate, to share our experiences, to learn more about the program, and to look forward to the future of its development. Because of the work and dedication of the evaluation team, Missouri is able to do more than just tell stories about individuals and families' lives have been changed through the Partnership for Hope. Always the show me state, Missouri now has actual evidence. We have proof that by supporting individuals and families when that support is needed, we can, 1, decrease the amount of services a family or individual has to use. And today you will hear examples of families and individuals who received what they needed, graduated from the program, and went on to be very successful. We can, 2, improve the economic well-being and prosperity of our communities, families, and individuals. Today we can demonstrate how this investment in community services creates jobs in communities as well as allows our families and individuals to improve their own economic standing. And 3, we can give the individuals we serve the independence they desire and deserve. The Partnership for Hope is the 5th of 5 Medicaid waivers granted to the Missouri Division of Developmental Disabilities. It was, however, the first of its kind. The groundswell for this program originated at the local level in response to a backlog of individuals who'd been waiting far too long for services. Often their requests were rather small, but their needs were very large. Beginning in 2007, the Missouri Association of County Development Disability Services began the work necessary to find a solution that would meet the immediate needs of individuals in their home, their community, and workplace, and prevent future crises in their lives. The original name proposed for this program was the Prevention Waiver. Governor Nixon later changed that name to the Partnership for Hope, and today all but 11 counties in Missouri participate in this waiver. I'll pause here just a minute to share with you that I was, as Les indicated, part of some of the discussions as this was being rolled out. And the governor, I'll recall, and Jeff Harris is going to be here later, I'm sure will support this. The governor thought that this was a great idea. Loved the idea, the concept of this program, and how creative it was. But he thought it was the dumbest name for a program he'd ever heard. And so when you talk about the prevention waiver, he'd ask, well, are we waiving prevention? Or are we going to prevent waivers? Which is it? And so we went to work. Harris has just walked in, and he's going to support this. We went to work on, or they went to work on, we need an idea that really, a name that really captures the spirit of this program. And one of the real strengths of the governor was how to package and describe and sell and promote a program. And so the prevention waiver became the Partnership for Hope, clearly a name that resonates and that captures the purpose and the spirit of this program. But the governor was never shy in his disdain for that original name, as well as how personally he took this program later on. This was one of the programs that I know meant a great deal personally to the governor. He was proud of it. He has stayed very connected to it. It's one of the legacies that I know matters a great deal to him. As the name implies, this program is a true partnership. The County Senate Bill 40 boards contribute 18 cents for every dollar service. The state of Missouri then does the same, and the federal government contributes the remaining 64 cents. The local case management agency also does the eligibility and service approvals, giving more control at the local level. What's really different about this program? Well, participation in the partnership is a county decision. That's not the case with other waivers that are administered statewide. Eligibility and need are determined at the local level. In 2010, the state had a large wait list for community services. Many individuals had been on this wait list for years with no indication that services would be available for them anytime soon. Families were struggling to meet the needs of their loved ones, and funding was only available to serve those with the most urgent needs. The Partnership for Hope allows us to help those individuals who otherwise were not likely to receive any support before they fell into a crisis. Thanks to this program and the necessary funding from the governor and the Missouri General Assembly, the in-home waitlist has been eliminated. Anyone requiring funded in-home services now receives those supports within 12 months or less. In the first 6 years of the Partnership for Hope, about $61 million in services has been provided to 4,300 people at a cost of about $11 million to the state of Missouri. During this last fiscal year, the average total cost per individual was $5,600. What's more, because many of these individuals were not in crisis, they were able to discontinue services after their needs had been met. In fact, since the program's inception, 31%, almost a third, of the individuals enrolled have been able to discontinue services. This demonstrates the value of making a difference in someone's life before the situation becomes critical. Today, you're going to hear from many individuals whose lives have been affected by the Partnership for Hope, as well as those involved in its policy and its management. You'll have a chance to listen and express your concerns and ideas about this program as well. I encourage you to stay until the end of today's conference for that listening session, because as we go forward with this program, your input will help shape and strengthen the future of the Partnership for Hope. Thanks very much for giving me this opportunity to be here on Director Stringer's behalf. I hope you have a terrific and enlightening and encouraging conference. Thanks a lot.
Good morning. I just want to thank, on behalf of those of us at IHD, when we first started talking about this between ourselves and then with our advisory committee, I thought, man, I will be surprised if we can even get 50 people here to listen to this. So it's really wonderful to see you all here, and I'm so thankful that there's this much interest in the Partnership for Hope. And I'm really excited to spend the day sharing a lot of the things that we've found over the past 4.5 years. So before I really get started with my presentation, I want to just actually Les and Dr. Neitzel covered a lot of what I was going to say, so now I'm just going off the cuff. But about a little less than a year ago, last summer, I was invited to go to the NASD's, National Association of DD Directors, and talk about a different project, some research methodologies that we were using. It was to their research section. So I gave my talk, and as soon as I was done, I thought they would ask me about that project. And the first thing that they started asking me about was the Partnership for Hope. They said, we hear that Missouri has this innovative waiver. What is it? So I spent time describing it to them and talking about it. And I touched on what Dr. Neitzel just said, that it had eliminated the wait list in the state of Missouri. And everyone said, no way, you're not right, that can't be. And I started to get nervous, like, oh gosh, did I get this wrong? Am I misquoting things? Did Val lead me astray? And because these were like nationally known researchers, and I was a little nervous speaking in front of them anyway. The people who do the national core indicators were there, and just a lot of people. And I said, no, we've eliminated that waiver. And so then a guy named John Butterworth, who some of you may know, he does a lot of analysis of Medicaid data, and he pulls out his book and every year he writes a new book about Medicaid waivers, and he pulls it out and he's like, oh, well, he's right. They have eliminated it. And so he showed it. And I tell that story mostly because a lot of times when I'm either in other states or presenting at conferences, people always want to know about the Partnership for Hope waiver. It is very innovative, and it's recognized, I think, around the country as something that other states want to try to emulate. So congratulations to all of you. Missouri really is on the forefront of this. So with that, Manuel, if you'll go ahead. So as I mentioned, some of the things that I was going to say have been mentioned, but I just want to kind of touch on the basics. So the purpose of the Partnership for Hope waiver was to prevent or delay out-of-home placement, and it was for people who were living primarily in their family setting, and we wanted to prevent them from having to move out of their natural home, and we wanted to do that before they went into crisis. So, as you all know, it's a unique collaboration that includes the Senate Bill 40 boards, the Division of Developmental Disabilities, and then CMS, Centers for Medicare and Medicaid Services. And as a part of that, the SB 40 boards who participate, which is most of them now, pay half of the state match, and then to draw down the federal funds, and the annual cap is $12,000 per year. At that same conference that I was talking about a minute ago, when I talked about the fact that it had a $12,000 a year cap, none of the people there would believe that either. They felt like, how can you really provide services adequately for $12,000 a year? And I said, it's not only got rid of the waiver, but at that time, I believe the number was people are only spending, on average, $5,000 a year. So they're not even using that full $12,000, and they're getting what they need and are able to move on. So in terms of eligibility requirements, again, as you all know, you pretty much just need to be eligible for Missouri Medicaid, and then you also need to be residing in a participating county. There are some other things there, like confirmation that needs can be met with current community support system and waiver services, and meeting crisis or priority criteria. So next slide, Manuel. So the PFH waiver, as you all know, began in October of 2010. Within a year of its implementation, so by 2011, nearly 1,000 individuals with developmental disabilities were receiving supports through the Partnership for Hope waiver. It had already been renewed once within that year. Within 3 years, slightly over 2,600 people were receiving supports and services through the Partnership for Hope waiver. And then since 2010, and this number comes from a presentation that we made about 4 months ago, and at that time, the number of people who had been served using the Partnership for Hope waiver was 4,396. So with that as the background, within that first year, everyone knew that this was going to be very beneficial to the state, and it was making a big impact on the wait list, but also on people's lives. And so at that time, we started talking at the Institute for Human Development with the Division of Developmental Disabilities and with MAC-DDS and just different people about it. And ultimately, together, we all decided that this would be a really neat thing to evaluate. And as Dr. Neitzel said, it is the show me state, and we wanted to demonstrate that this was really working. And not only that it was working, but try to understand why it's working. Because if we were to understand why, then it's the type of thing that we can share with other states. We can also implement that in other programs in our own state. So with that, then we decided we drew up a proposal and talked with the division for a while until we got it just right. And in April of 2012, we began the evaluation process. And so really, we did quite a lot of things and tried a lot of things. But it all comes down to 4 areas. We wanted to see how it was impacting individual participants in the waiver. We wanted to see what the impact was on families. We also were curious to find out what is the impact that it's having on professionals at the county level. And then lastly, what is the sort of economic impact of the waiver? And those are the 4 areas that we're really going to talk about. And we both, I'm totally am remiss. I should have introduced sort of my partner in this whole evaluation, Kelly Barton, who is here. And she's been really great. And we've done this primarily together. And so Kelly and I will be presenting the results of the work that we've done. But we really didn't want this to just be the George and Kelly show. At least half of that would have been really good. I'm not going to say which half. But we wanted it to be more about the people who the waiver has impacted. And so we're going to have some panels of individuals, of family members, and of professionals. And then we are going to unveil we've been working on some video, which we call our Voices of Hope. We have some of the stars of our video here today, and we're going to have sort of our public debut of these videos as well as we go through the day. So before we go much further, I want to acknowledge some people. This was not a program that was conducted just by those of us at the Institute for Human Development, but it was a partnership with the division and with the Senate Bill 40 boards. And so we've met quarterly. Formally, we met quarterly, and then we all talked very regularly throughout the year as we did this project. And so these are the people who served on our steering committee throughout the whole life of the project. As you see, some of the folks here are no longer in Missouri, but we've replaced them with other excellent members. And it's just been a real pleasure to work with each of these people, and I just want to acknowledge them and thank them for their contributions to this. It's just been a real joy to work with them. So thank you all. Okay. I got one more slide. I sort of preempted it. So what are our notable accomplishments that we're going to really focus on today are just these things. Our Voices of Hope videos. As I mentioned, we're going to debut some of those today. These will be housed ultimately on the MAC DDS and the Division of Developmental Disability website, so you'll be able to see all of them. We won't get to watch all of them today. We're going to talk about our family quality of life study that we conducted, and then we're going to have family members participate in a panel. We're going to talk about the impact on professionals in the field, and again, we'll have a panel of professionals, and then we're going to talk a little bit about the economic impact. So thank you all for being here.